Kim Farrar is mourning the loss of her mother this year, a grief complicated by lingering outrage over the stress her parents endured in their final years. She says her father, Jim, deteriorated terribly in the 4.5 months he spent in hospital before finally accessing an aged care bed. The situation was even worse when her mother, Eileen, needed specialist care after being badly affected by a stroke.
She was in the hospital for a full year, waiting for a nursing home. My sister and I would go every day. My sister would go up during the day and I would go up during the evening. The hospital was not a place for my mum to be.
She was horrified but not surprised to hear that 3 years on, dozens of other families are going through the same ordeal.
We've got to take care of them. I mean, they need to have dignity in their later years when they're on that end journey. And I think it's just a horrible thing for families to go through.
NT health figures show 57 aged care patients are being housed across the NT's hospitals, with advocates saying people are dying before being able to access aged care.
It's a really sad situation. They haven't got a choice. If you're level 4 and your family, unfortunately, it's a very high needs, then you'll end up in either the Royal Darwin Hospital, the Alice Springs Hospital, probably the Catherine Hospital as well.
The impacts on the health system are staggering. Overcrowding at Royal Darwin Hospital has seen elective surgeries cancelled 3 times this year under emergency measures known as Code Yellow.
You can understand in one way why there was a Code Yellow. If there's 50 or more beds being taken up which shouldn't have been taken up, then, the Code Yellow might happen again.
The federal government, which has responsibility for aged care, says 110 new aged care beds have been approved for local providers, but not yet delivered.
Generally, it takes around 3 to 4 years from when an ACAR bed, a provisional bed, is provided by the Commonwealth to the construction and that bed coming online. But we can't afford to wait that long.
Recognising the gap in services, the NT government says it's been allocated 60 aged care beds to deliver specialised dementia treatment. But there's no funding for the construction of the purpose-built facility and no information on where it would be built. The government is confident it will open within the next 2 years.
The Department of Health is actively looking at what they can do to deliver those beds, where would we do it and how would we deliver that.
A change that could save seniors having to wait months in hospital for aged care, as Jim and Eileen Farrar did. Laetitia, Lemke, ABC News.